Welcome to the Prospective Doctor Podcast, where we will provide essential information for pre-medical students and those already in medical school. Listen each week for tips on how to improve your application and gain an acceptance to medical school.
Hi, thanks for joining me. My name is Dr. Renee Marinelli, and I'm the Director of Advising at Med School Coach. Today, I wanted to talk about extracurricular activities, and in particular, how many hours of extracurricular activities do you need to be a competitive applicant to medical school? I get asked this question a lot, almost by every applicant I start working with. And it is a valid question. As most of you know, when you start filling out your AMCAS application, you will have to input all of your extracurricular activities that you have done in the last several years. And specifically, the AMCAS application requires you to enter an estimate of the number of hours. So applicants automatically wonder, how many hours is it that medical school admissions committees want to see? Unfortunately, there isn't a direct number. I wish that I could just give everybody a formula and say, okay, if you do X amount of hours in community service, then this is going to make you look competitive. But unfortunately, that's just not available. After reviewing hundreds of applications and working with hundreds of students and being on an admissions committee, I can tell you that there isn't one number for any one of these extracurricular activities that you should be shooting for. Rather, and you'll hear me say this probably a few times in this podcast, it's all about quality of the experience over quantity. So let's look a little bit at what we do know. So most pre-medical students will have several different categories of extracurricular activities. And it's pretty understood across the board of admissions committees that an applicant should have a few of these different activities to be competitive. You should have research, you should have physician shadowing, you should have some kind of clinical activity where you're exposed to patients, you should have some kind of community service activity that is ideally volunteer work outside of medicine, and also a leadership activity. So those are the 5 categories that let's look at today to see what we know about how many hours and how many experiences you should have. Let's start by looking at the MSAR, and it stands for the Medical School Admission Requirements. So basically, the AMC talks to all of the different medical schools across the country and gets data from them as far as their average MCATs, their average GPAs, courses required, all of these different things that go into making a medical school admissions decision. So one piece of data they actually do collect is pre-medical experience from the matriculants into their medical school. This is not the number of hours that the matriculants had, but it's rather the percentage of matriculants that had a certain activity. So going back to those categories we talked about earlier, so community service, research, volunteer work, etc., how many of their matriculants actually had those? So let's look at one of the top tier medical schools, Johns Hopkins University School of Medicine. 97% of their matriculants had research. 90% had medical work. 84% had physician shadowing, 83% had community service. As you can see, most applicants that are successful have these experiences. Again, this doesn't tell us the hours, but it gives us an idea that you definitely need these experiences to be successful. Let's look at another medical school, another private medical school, more of a middle tier medical school, Tufts University School of Medicine. Another great medical school, but it is not as competitive as Johns Hopkins. Students here, 92% of them had research, 86% of them had clinical work, 78% had physician shadowing, and 76% had community service. So again, even at some of these middle tier to lower tier medical schools, you definitely still need these activities on your application to be competitive. Now that we have made it very clear that you actually have to have these activities, how much of these activities should you have? There is very, very limited data available on how many hours of each activities applicants apply with. The best data that I have ever found came from the University of Utah School of Medicine. And they actually published a document a few years back, but still helpful, about the average number of hours that their applicants had. Let's start with community service. So at a minimum, they expected 36 hours to be completed, and at an average, 100 hours to be completed within the last 4 years. I think that this is probably a pretty low ballpark. Obviously, this is just one medical school and one set of data, so it is limited in what we can glean from it. But from what I've seen from reviewing hundreds of applications and working with other people, is most applicants will have multiple years of a community service activity. So let's say somebody has done a community service activity for the last 3 years, and they do it 10 hours a month. 10 times 12, that's 120 hours a year, times 3, that's 360 hours. So you can see that those hours accumulate pretty quickly. Again, this is not a set number, but I think you can kind of see my point here is that it's important to have an activity that you're dedicated to and that you've been spending time doing for a long time. It's definitely going to look more impressive to medical schools if you have dedicated yourself and spent time with a community service organization for several years rather than just a month. So when you're looking for these types of activities, try to get a community service activity that you're going to be able to be involved in throughout your undergrad career or wherever you are on your path to medicine. So for example, let's look at a youth tutoring program. You could get involved in this your freshman or sophomore year, and you could continue tutoring the youth for maybe 5 to 10 hours a month, or maybe more than that, throughout the full 3 or 4 years before applying to medical school. And by the time that you do apply, those hours will accumulate. So again, it's more about that quality of experience, the longitudinality of it, rather than just putting a set number of hours on your application. Let's go ahead and explore another category, leadership. Leadership is often a hard category for medical students to identify with. They don't really know what counts as leadership. So let's talk a little bit about that. The University of Utah says that a minimum expectation, applicants should have 1 leadership experience within the last 4 years and an average of 3 different leadership experiences in the last 4 years. After reviewing a lot of applications, I think it's hard for applicants to have 3 leadership activities unless you kind of broaden your terms of leadership. So obvious leadership positions are a president of a student board, president of AMSA, some kind of coordinator for a program, but you can also have leaderships in your church, in sports, and throughout other kind of activities that you may be involved in that you can definitely count as leadership experiences. So perhaps you were a volunteer coordinator. That is definitely a leadership experience. Perhaps you were one of the organizers of your softball league. That's a leadership experience. So you can kind of categorize different activities based on what you did there. And again, this is going to be more about the quality. Were you a leader for one softball tournament, or did you organize a softball league for several years and bring in multiple players? That quality and the activity that is substantial, significant, and really can show your abilities as a leader is going to be viewed much more favorably among admissions committees instead of just having a ton of different leadership activities listed. Let's go to research. So research is a very, very big part of the medical school application. And as we looked at those stats, Johns Hopkins, about 90% of the students had it. And the same with Tufts, about 90% of students had research activities. So you definitely want to plan on having some research in your application. The University of Utah says at a minimum, you should have some research experience where you were part of a class where you tested a hypothesis. On average, their applicants will have a hypothesis-based research project that is supervised by like a PhD or somebody with research credentials. I think that this is pretty typical of what I see on most successful applications is, for the most part, Applicants will have one dedicated research experience where they started from very early in the experience and began working with their professor, working with other students, and designing a project, testing a hypothesis, and coming up with some type of results. So the hours for research I have seen vary. Depends kind of on what the project is and when the applicant started it. Some applicants will start a research project when they're sophomores and continue it all the way through their senior year. So they may have a couple thousand hours. Some applicants will do like a 6-week summer research immersion course where they start a project, test a hypothesis, and get results. And maybe their hours are somewhere around 200 to 300. Again, quality here is much more important than just the hours. Medical schools don't want to see that you just spent hours and hours and hours upon hours in the lab. They really want to see what it is that you learned and developed from being in the lab and testing a research project and going through the hypothesis and gathering results. Did you produce a presentation? Did you get a poster? Did you publish your results, or did your lab publish their results, or are they expecting to publish their results? Those are really the important things that you want to get out of a research project. More about what it is you can say you gained from it. Not just you sat there doing PCR and you're an expert in PCR, but that you learn how to deal with problems. You learn how to come up with different solutions, ask for help, and you learned about the scientific process. If you can say that you did all those things in a research project and maybe it was 100 hours, then that can be sufficient. Again, try to dedicate as much time as you can to a research project, but it doesn't necessarily mean that you have to spend thousands of hours in the lab. Our next category is physician shadowing. I think I get asked the most about how many hours you need here in physician shadowing. So a minimum from the University of Utah is 8 hours, an average 24 hours. I probably see most applicants with about 50 to 100 hours of shadowing on their application, and I think this is sufficient. Ideally for shadowing, you want to have the shadowing be with multiple different physicians in different specialties. If that's not available, that's okay. If you spend 20 hours shadowing a primary care physician and 10 hours with a pediatrician, that's fine. But I think you should also really try to shadow as many different specialists as possible for as long as possible. Shadowing is a great way to view what a medical specialty is like and see what doctors do, but you don't get a ton of hands-on patient interaction, which is a very, very valuable experience for pre-medical students and something that medical schools really want to see you have. So try somewhere between 50 to 100 hours, but then also really focus your time on clinical experience or patient exposure. The University of Utah says minimum of 32 hours and an average of 48 hours. I think that this is a little low here. I think most applicants are probably going to have over 200 hours of some kind of clinical experience. You definitely want to make this a priority when you're looking for extracurricular activities, trying to find some type of activity where you're working closely with patients, you're working with the healthcare team. This is ideal. Again, not so much about the quantity, although you should have a good amount of hours here, but really about the quality. If you're just going into a hospital and sitting down at a desk and directing people to different floors, that may be a good place to start. But you really want an experience where you're going to talk with patients, you're going to be able to see some of the medical procedures being done, and maybe tag along with the physicians and nurses. Those are the clinical experiences that are going to most replicate the actual clinical experiences you'll have as a medical student. And medical schools want to see that you're ready for that. So try to get those types of experience where you're involved and you're part of the healthcare team as much as you possibly can be at a pre-med level. Some people work as EMTs, scribes, hospice volunteers. These are all good experiences to get a little bit more patient interaction than the most typical hospital volunteer. So we talked about the 5 major categories of extracurricular activities, and I tried to give you a ballpark of hours that you should shoot for. But I will emphasize once again, it is all about the quality of experience. What is it that you've gained, that you've learned? What skills and abilities have you developed from those experiences? That is what medical schools really want to see. This is by no means a ticket to quit your volunteer work and say, hey, I did 50 hours, that's enough. You really want to continue your activities as much as possible. Make sure they're longitudinal. Try to stick with an activity for your entire undergrad experience and keep going with it. That is what's going to be very impressive to medical schools, is your dedication, your motivation, and your passion for a particular activity. Sticking with something and seeing it through is going to look much better than just devoting 200 hours in a short burst. Try to stick with your activities. Make sure that you have dedicated yourself to it, and focus in on how that activity has really improved you as an applicant to medical school. Thanks for joining me today. I hope this information has helped a bit. Please join us next week for our next podcast episode.
Our mission is to inspire, encourage, and inform students as you journey through a rigorous and intricate process of achieving your dreams in medicine. Visit us at prospectivedoctor.com for more essential resources in your medical school journey.